Hi, everybody. Welcome to today's webinar. We're so glad you're here. I'm Sharon, the Director of Client Success at CE Zoom and Zoom Education. Sorry, I'm going to really quickly stop sharing that for a sec. Welcome. Thanks for being here on this Tuesday afternoon. I'm going to go over a couple housekeeping items, and I'll also put the instructions in the chat if that's helpful for you, especially for those of you who haven't used CE Zoom before. This is a 1-hour 1 CE course with time set aside at the end for Q&A with our presenter. And so if you have any questions for the Q&A, please go ahead. You'll see the little, there's a chat box at the bottom, and there's also a box that says Q&A. Click on that and you can ask questions there. And CariFree Cooperative is really great at asking those questions. And if we don't get to them during this webinar, they'll do a follow-up. So at the end of this course, we will display a verification code. I'll also read it out loud. And to get your CE certificate, you are going to go on cezoom.com, log into your account, scroll down until you see this course and click the green verify button. And once you click on that, you'll enter the code given at the end of this course, take any mandatory course evaluations, and then please allow us 72 hours to check the analytics and confirm your attendance. Once all those steps are taken, your CE certificate will be located in your CE Zoom account on your dashboard, and it's under Records and Manage CE. If the green verification button isn't there yet, please wait, it will be there. It won't happen until after this course is finished. So now I'm going to turn the time over to Laura to introduce our presenter.
Sharon, I'm going to pop in. My name is Jenny. I'm going to pop in right before Laura. And I want to say thank you, Sharon, and thank you everyone for attending today's webinar. We're so excited to have you with us today. And this webinar is graciously sponsored by the CariFree Cooperative. And the CariFree Cooperative was started by CariFree as a way to bring together like-minded dental professionals who are working together to further that message of risk assessment, preventive dentistry, oral and overall health and wellness. Our presenter today is Christine Taxin, one of our very own co-op members. So I'm going to pass it off to Laura to share just a little bit more about her.
Thank you, Jenny, so much. We're very excited to be here today with all of you, so thanks for joining. I have the pleasure of introducing Christine Taxin. She is a visionary in the field of billing and dental wellness. She's educated and inspired teams across the country to help them increase production, improve collections, and most importantly, revolutionize their approach to patient health. She's over 40 years of experience in medical offices, and dental education, and she's a nationally recognized speaker and has authored and published 15 detailed manuals on how to navigate medical insurance billing in the dental office. We are so thrilled and excited to have her here today. So it looks like she's getting her PowerPoint ready. So Christine, yes. As soon as you are ready, you have
I am ready. I want to, but first I'd like to say something. You really make me feel special, and I'm not really, it's amazing how you guys have been part of my life for so long, and that's part of what I wanted to talk about today, and why this company is so amazing to me, and why the center care approach impacts patients' perception, and this year even more. So I want to specifically thank Laura and Jenny for working with me, helping me all the time, and Dr. Kim is an amazing visionary, and I am so happy to be part of what he has been doing for years already, and thank him. So I want to thank all of you. So we are ready to begin. And my focus today is on the changes and the ability for patients to understand more than ever before how amazing dental care really is. And the fact that patients have changed their perception on what we do and how we do it. And the reason being is that we are really, truly at the forefront of patient care in making sure that we are available to patients in ways that we've never really focused on ever before. So I want to make sure that we are on that path even more. And the point of this webinar is to teach everyone what we can do to make a difference in our patients' treatment. So let me, not sure why this is not working. I am apologizing. I am on a new computer, and I know this sounds crazy because people think I'm crazy when I say that if I change a computer, I'm in bad shape. So please forgive me. I'm using a different approach and it's not working. So I don't know if Jenny or Laura or anybody can switch the pages on this PowerPoint. You're in the middle.
Christine, you should be able to use your space bar or your right arrow to switch your slides.
So more than anything is Dr. Kim, and thanking him again for everything he's done for specifically even my family. So you're going to hear the story of how my family started working with Jenny and Dr. K about 16 years ago, and how a patient-centered care approach positively impacts every perception and treatment outcome. Patients who keep their teeth live 10 years longer than patients without their teeth. Charles Mayo said that over 100 years ago. And he was really the first doctor who started documenting the good, the bad, and the ugly on billing and noting and documenting patients' illnesses, infections, and why it was important for them to be able to have the ability to work with companies in making sure that patients understood that the oral cavity was the gateway to health and well-being. And yet we took another 100 years to actually see, after coronavirus, that he was right way back then. Now, we've had doctors treating patients in a collaborative effect, but not enough. We have to make this part of our overall focus. It can't be just some doctors of oral health. It must be all doctors of oral health. And FDA this year started an 11th designation, which is the oral physician, the oral doctor. And we as team members need to also learn about this. And just to let you know, I was a team member and I was searching for an answer for my own daughter. And in that answer came my ability to work with Jenny and look at the products. So you never know where you're going to find help. You never know what company is going to stand out to you and why it stands out to you. This is not about the product as much as the company backing this product, and of course the product and its use. But the fact that I was able to approach that team through Jenny gave me the ability to bring it back. And now I am the honoraria of being able to teach other teams what I learned 16 years ago from Jenny. So it's been really a full circle for me. History data collection is not something dentists work well with. It's not something that we do well. Yet when I teach at NYU or Harvard, the students write a book, and the book is a long book because they have time in between seeing patients to document more and more information. But yet, when we get to work, the first thing that we change in our lives is how we document. We start to text message. And I learned that really from many other professors and other teachers, that when they visit with students, the one thing they have changed, which was the worst mistake they could make, was the effect of their documentation. Not only are you not giving yourself the information as Charles Mayo did, where you could go back and say, wow, I could look at 15 charts and see that I had 15 patients with this infection, and this is the outcome from that infection. We can't do that in dentistry the way you can do that in medical because of our documentation. And then the second thing, it is legal action against us when we have no correct critical information in our charts. So we have to be very careful when we do that. And as pertinent medical records, the best results, the test results, and the consultation report are so important because we have to have that information in order to be better prepared for treating patients and for an audit in our office. So we really need all of these things. We can't help people who don't help themselves. So when I hear an office tell me, well, the patient doesn't really want to fill out a new medical history. Well, where could any patient in any other field of medicine be treated without that pertinent information? Nowhere. So why are we concerned with the fact that some people complain? We cannot treat people without that information. You have to determine what the patient has already done to manage his or her symptoms. So if they're coming in and they were in pain and they're swollen, what did they do at home prior to the office visit? Did they speak to us? Should we document what we told them to do? It's a bad habit when we speak to patients over the phone and not documenting it. We must document every single conversation we have. If they haven't called us, did they call someone else? If we're talking to them as a team member, are we documenting all of this information? That's not done on a regular basis. So we have to read the notes by other healthcare professionals if they went to someone, or if they spoke to someone in our office, whether it be a team member, the doctor, a hygienist, it doesn't matter. We must be able to help them. And pertinent medical records and the test results that we're performing and the consultation reports available, have they been reviewed? And one of the greatest things I could tell you that happened to dentistry this year, I know that everybody's tired of hearing about the pandemic, but the fact that we started using teledentistry, we started using teledentistry so we could connect with our patients before they could come into our office. We started using this parking lot dimension in collecting the paperwork prior to them coming in. We started asking for more medical history before they came in. And we actually obtained medical information from their medical providers before they came in. And what did that do for us? That helped us greet a patient with all of that knowledge. And when they were seated in the operatory, after they rinsed their oral cavity in the bathroom, they made sure they clean their hands. They will walk to the operatory where again, they were rinsing with Cari's products. And then we were able to walk into that operatory and let them know that we reviewed their medical history. We know that they're diabetic. We understand they're diabetic, and we want to be able to help them because the oral cavity and diabetes, which is an infection in the entire body, when you really think about it, can hurt them in the oral cavity. So think about letting them know that you already know all this and what and how your treatment is going to help them. The communication flows easier. The team is able to engage from the minute they speak to this patient. They've actually already met this patient if they've never been in our office because they're using teledentistry. So my feeling is don't stop using it because people are actually accepting it. They're much more at ease when we can tell them all this information and the positive outcomes that could come from treatment. They are accepting more treatment because of it. And the fact that we stand out above and beyond others is going to be the key to more success and treatment plans that are amazing. Patients do not want to be viewed as a number in the waiting room being chosen to come in. They want to be viewed as individuals. They want to let you hear about them. They're the ones telling us the story, whether they have diabetes, whether they don't, whether they have another illness or whether they don't, and then actually listening more than we speak. We've had a habit of speaking more than listening. And I say, change that. Let's start to listen to our patients because they're here for our knowledge, not our family history, not what we did over the weekend, but they're here to hear what we have to say as professionals. And whether you are working as an administrator, an assistant, a hygienist, or you're the doctor, we are the professionals. And if we're speaking about other things, we're not hearing our patients. And that's something that we critically have to understand. When deciding whether to use an available or limited healthcare resource, use sound medical judgment and act in your patient's best interest. Don't ask if they want an oral cancer screening, or they want an oral saliva test, or they want, no, it's not about what they want. It's about our expertise in what they need. So we have to stop looking at what insurance is saying, especially dental, and start to treat patients for what they need in order for us to treat them. So instead of saying, well, we'd like to take a biopsy of this area, why not say what any other medical provider would say and let them know that we are going to perform a biopsy so we can rule out anything other than we need to remove it or diagnose it further, that whether we're going to use a CBCT scan to see something that we can't really visually see even on an x-ray, or we're going to use a saliva test or other investigative things that we have available to us like never before, including the fact that we've been involved in the medical world by taking tests for COVID or giving the injections for COVID. So you could really see that that's not going to stop. That's going to continue to grow in our field because we are able to see a lot more people than even a medical doctor can see, because we are using hygienists and administrative assistants and everybody to help the patient understand that we're current on all clinical practice guidelines. And we use these tools so that we could come to not a suspected condition, but a definitive investigation that gives us the best results in helping the patient get the positive results that they want. And that your completed diagnostic imaging request or contain pertinent clinical information to help find the correct diagnosis. We need to stop telling patients what they need, but why they need it. And that's where the diagnosing comes in. And using all of these tools from saliva on is to help a patient understand why they're having so many caries. Why are they needing a root canal? Why do they have perio infection? Because we can determine the why with tests. So how many infections are we really looking at? And has your team ever really had a conversation with you about this? We've learned this in dental school, but we haven't really talked about it in our practices as much as we should. So let's take a look. We have all kinds of viral infections in the oral cavity, and that viral and fungal infections destroy the oral cavity because unless it's treated, it will not just dissipate from our oral cavity. Remember, if you had a viral infection or a fungal infection in any other part of your body, you would have clinical effects, you would have a diagnosis and how to manage it. So I want you to think about, you have bronchitis, you go to your medical doctor, and your medical doctor says, yeah, I hear your chest is wheezing. I want to take an x-ray of your chest to make sure it's not into pneumonia yet, and how we're going to treat you. So you go for a chest x-ray, he comes back. He already diagnosed you, but now he's confirming that diagnosis with that chest x-ray. You're confirming your diagnosis with an oral saliva test so that you could tell what type of viral infection or fungal infection is present. We have a lot of them that we have not even looked at. Herpes, especially herpes, and by all types of mumps and measles and rubella. And I want you to think about children. They get those diseases and they end up with a lot of sores on their lip, sores on their tongue, and it's because that virus is moving through them. Mononucleosis is a mostly childhood teenage diagnosis, and everybody says, well, it's a kissing diagnosis. Well, it's actually a transmittable diagnosis, and all of these are transmittable. Remember, if you have bronchitis and you were diagnosed and your doctor said, yes, your x-ray confirms this, I'm going to put you on 10 days of antibiotics and I want you to come back so I can retake the x-ray and clear you from treatment. You go home, you walk in the door, your kids are running up to you to say hello. But you say, don't kiss me because I have bronchitis, because we know bronchitis is transmittable. Well, we need to start to tell patients that these infections are transmittable. And the fact that we go home and kiss our family or drink out of a cup with someone is actually transmitting viral infections in the oral cavity. So we need to start to talk about this for our patients. Transmission is part of everyday oral infections. And we need to make sure that we start to tell our patients, this is family related. I'll never forget when I first started in dentistry way back when, and somebody said to me, oh, I have gum disease, it's hereditary. My entire family lost their teeth at young ages and they all wore dentures. And to some respect, they were on the right track. but it's not hereditary, it's transmittable. So if a family has severe gum disease and we don't take care of it or look at it as a transmittable infection, then the whole family is going to have it, from children to the oldest adult in the family. So we need to, that's why children should be seen at a very early age. And remember, people kiss children a lot. Do you know who's kissing your children? I don't know. There's general and clinical aspects of a lot of this. So fevers are usually a sign of an infection. It could be a headache. It could be nausea. It could be just their lymph glands get swollen, or their lips and tongue, or they're dry. And so we really have to pay attention to when somebody says to us, and that's why them speaking to us is more important than us, is that they felt this. Because an infection in the oral cavity can cause patients to be tired, can cause patients to be extremely compromised in catching or transmitting and being transmitted more. There are many, many oral manifestations from these, from puffy, swollen gums to what we think sometimes is that, the pizza burn on the roof of the mouth. We need to pay more attention to that, because I've seen many patients that have had major issues thinking it was just a slice of pizza that burnt the roof of their mouth. And we need to really look at the oral cavity, not just for oral cancer, but for signs of any oral manifestations. We have a lot of dental aspects with, oral infections. And we know that when children are crying as they get to a certain 6-month-old period, we say, oh, they're teething. Yeah, they are teething, but let's take a look at other signs besides teething. Did they break out in any herpes or things on their fingers or any other viral infection on their body? So children can get impetigo, for instance, which is a transmittable disease when they go to the playground and they go into sand. And we never think about it as in the oral cavity, but it's not. That is not true. When you get a herpes infection, it could be oral, it could be anywhere else on the body. So we really need to know what type of infection we're dealing with. And then finally, we need to know how to diagnose it, which is, there's only one way of diagnosing it, which is some testing. And we have to be able to manage it with products. And this is the main focus that we need to get onto our patients when they are diagnosed finally by us. And then we send them home after treating them in our office. But are we emphasizing on what products we used while we were treating them? Did we irrigate? Did we use rinses? What did we use to get that area under control that they must use at home? And it could be an oral antibiotic. It could be rinses. It could be toothpaste. It could be a lot of things, but they need to know that this is not a choice, but a need, because without them controlling these infections, we can't even help their entire family. You're not going to stay away from your family forever. So let's let them understand that their treatment is based on keeping everyone in their family healthy. And we should also emphasize that if they have gingivitis or they have any type of infection, that they should have their entire family examined and treated at the same time if need be. remember, go back to what people understand. Bronchitis, everybody's heard about it. Everybody knows it, and everybody knows it's a contagious disease. Bronchitis also causes issues in the oral cavity. Remember that the saliva in your oral cavity travels, and we see more patients in nursing homes that end up with pneumonia from bronchitis because the oral cavity has not been cleaned, or they're not doing home care, which is killing that infection on a daily basis. In fact, using the product should be more than one time a day. Transmission is from contact with saliva. And that is really why we are talking about this today, because without products, we can't help our patients. Without testing, we can't help our patients. And this year, we learned a lot about the pH neutralizer, the xylitol, the nano HA, the fluoride, and the antibacterial products, because we had a transmittable disease this year by saliva, because droplets and your oral cavity that we had to cover for so long is spreadable. So we have to start to show patients that, yes, we understand. Yes, we look at all of them, not just their teeth, but everything, and that the products we're using when we use CTX is because we've learned even more on the antibacterial issue and how to neutralize everything. And the use of these products is one of the ways that I could tell you, I told every patient in my husband's office to use for an extra protection during the coronavirus. Autoimmune diseases that increase risk of mouth sores, patients with Crohn's disease, it's the digestive tract. I want you to think of the digestive tract as one part of the oral cavity. That's really what it is. So if you see Crohn's disease is a K diagnostic code, K50.00. Why is it? Every oral infection is going to come from somewhere in that area, or lupus, a systemic disease, which is in the M category, because systemic lupus is in the oral cavity. We have to know that. For psoriasis, a skin disease that really causes mouth sores, but can be diagnosed in the oral cavity. And celiac disease, another digestive disorder. So I want you to look at patients that say to you, well, I have Gert's disease, or I have dry mouth, or I have any of the symptoms. There's something going on with that patient. And we need to start